This is CBS 2 News this morning.
6:25 this morning, the FDA is taking a close look at unapproved stem cell treatments. CBS 2's Natalie Hurst has some important safety tips to help keep you and your family safe.
Health officials say the patients in Arizona, Florida, and Texas suffered from bacterial infections after getting unapproved stem cell shots contaminated with E. coli and other bacteria. The FDA says it is focusing more on resources on enforcement when we see companies skirt safety measures and put patients at risk. No doubt a reference to the booming network of private clinics that are promoting and administering stem cell therapies for unapproved and unproven uses like treating COPD or diabetes. In fact, stem cell treatments are only widely accepted to treat blood disorders like leukemia and some forms of anemia, and in some cases to help burn victims. But if you are considering stem cell therapy, how can you tell if it's legitimate? One of the first tips, beware of big price tags.
Clinical trials involving stem cells don't usually have flashy advertisements, don't promise to be a cure-all, and shouldn't cost you big bucks.
Also, don't just settle for patient reviews.
A doctor working with stem cells should be able to tell you where the stem cells came from, what's being done to them before they're injected into your body, and exactly how they'll help you.
And finally, make sure to read the fine print.
If the stem cell treatment you're considering is part of a clinical trial, make sure the FDA has given it a green light as an IND.
That's an investigative new drug application, and the FDA advises patients to ask to see the approval letter to make sure it's being issued for the treatment you're considering. Treatments that have this approval are much more likely to be safe than those without it. Natalie Hurst, CBS 2 News.
Well, still to come on CBS 2 News this morning.